Roma, and we must talk about the vulnerable plaque. What is vulnerable plaque? When the vulnerable plaque means there is a less of calcification, there is a more of lipid, and the covering layer is very thin fibroatheroma, thin cap fibroatheroma. It's called TCFA. When the diameter is less than 49 micron thickness, it is very rich in macrophages, up to 14%, in contrast to stable plaque, which is only 2%. All these can be assessed by CT angiography. These plaques are more likely to rupture and develop into ACS. This is our worry. We must try to prevent, as far as practicable, attack of acute coronary syndrome. Cardiac CT angiography provides direct visualization of the vessel wall, thus providing good assessment of atherosclerotic burden. The wall component can be classified in Hounsfield unit as a soft and rich lipid with fibrous atheroma, calcified atheroma, 30 to 60, 70 to 120, and more than 350 Hounsfield unit. So, inflammatory markers, what does it represent? It represents a very active atheroma. Atheroma patch or atherosclerotic patch is very active. There is a progression of atherosclerotic phenomena. If we find hsCRP, interleukin 6, leukocyte enzyme, myeloperoxidase increased level, then these are inflammatory markers, and they indicate inflammatory status, an indicator of atheroma formation and progress. This is very important, and the two landmark trial, CANTOS trial with canakinumab and COLCOT trial with colchicine, they have shown that by treating with anti-inflammatory drugs, we can reduce the hazard ratio, we can reduce the mortality. So these are important trials or we can call it, they are landmark trials as far as inflammatory markers is concerned. Now, what is asymptomatic atherosclerosis? How can we detect by coronary artery calcium? Coronary artery calcium can be addressed by HRCT or CT angiography. They denote late stage of subclinical coronary atherosclerosis. But mind you, these are not always present. They denote total coronary plaque burden, but they are not indicator of stability or instability of the plaque. However, in acute coronary syndrome, coronary artery calcium is more pronounced. Quantification of the coronary artery calcium can be done in Agatston unit, and if it is more than 300 units, it indicates increased cardiovascular risk. It has got a very high negative predictive value. If the Agatston unit gets a score of 0, it has got very high negative predictive value, almost 100% ruling out significant coronary artery disease. Coronary artery calcium improves risk prediction in addition to the conventional risk factor. It has got an independent value. Pardon? Yes, I will just give. Okay. The obesity and metabolic syndrome is very important. It is full of inflammatory markers, and it is not a simple obesity. It has got a value of inflammatory status. So how to approach the problem? We are going to deal with the risk factor and risk assessment, and risk assessment has already been done by our previous speaker. And I will just take 2 minutes time by telling you that psychological stress has to be prevented and managed. Emotional stress is very important in acute coronary syndrome. A study has been done with the PET scan with fluorodeoxyglucose and recently published by a French journal and from European Society of Cardiology. They have published an article, and they have studied that there is a very high amygdalar activity in patient with stress and leads to macrophages hematopoiesis, and that macrophages has a link and leads to the acute coronary syndrome. So this is very important. I cannot show you the picture of this, but to sum up, I must say the promote healthy lifestyle throughout life. Coronary artery risk equivalent should receive serious attention. Diligent search should be for risk factors and look for silent coronary artery disease. We must assess and treat inflammatory marker. We must give statin, and because it has got a favorable effect. Guidelines should be shorter, crisp and user friendly, and team based approach should be done. Yoga should be incorporated in lifestyle management. I must say yoga has an impact on mental health, and Om chanting, Brahmari Pranayam and others can reset carotid sinus receptor, just like the BAT, which is called baroreceptor activation therapy, and the French journal is full of baroreceptor activation therapy in serious hypertension. But at the end, I will say that the practice of medicine is an art of bringing scientific knowledge to the needy. This requires dedication and wisdom of physician. And I'm sorry you couldn't see the slides, but if there's anybody who wants to correspond with me, my mail is aksinha@gmail.com. Thank you very much, madam.